Hey, Dr. C here with you. So when is thyroid medication necessary? You may have been told that you need to go on thyroid medication. A lot of people are, kind of a odd situation, but in the conventional world, they're quick to use T4, like Synthroid, as the answer to most thyroid issues. The natural world is kind of the same, except for they use different medicine. I hate to say it, but it's true. Yeah, natural thyroid or T3, but they rely on it way too much. Nearly everyone diagnosed with pretty much any kind of thyroid disease, many get recommended thyroid medication. And here's the deal. We've got a lot of evidence saying that the medications don't help most of these circumstances, and they're not harmless. So let's talk through this, and you'll know pretty quick if you're someone who needs to be on thyroid medication. So, quick primer, what do thyroid hormones do? A lot. They regulate nearly every important chemical reaction in the body. The big three categories are turning food into energy, helping the brain, the nervous system, work better, and then repairing connective tissues like skin, hair, and nails. So, when these things don't work right, that's why we see the classic symptoms of easy weight gain, fatigue, hair loss, dry skin, brain fog, poor memory, slowed reaction times. So then, what are thyroid hormones, thyroid medications? Well, they are versions of thyroid hormones that are made into pills. And they come in two categories. There's the ones called synthetic, and those are versions of T4 and T3. The body makes T4 and T3 from the thyroid, and then there's countless other ones that are made out of that when these hormones circulate. So yeah, so meds replicate T4 and T3, or there's natural thyroid, which is also called natural desiccated thyroid. This is freeze-dried, glandular, desiccated pig thyroid, and it's got more than the T4 and the T3. So what do these things do? Well, you take them by mouth, they enter the bloodstream, and they work in ways similar to what the body would make by itself. I say similar. A while ago I might have said identical, but we now know it's not identical. For those who lack a thyroid, it's life-saving, it's super critical, and they're helpful in many cases, but they're not the same as having a healthy thyroid. Here's the thing, some big studies have looked at this question, and they show that those on medication with normal levels have different health effects than those not on medication with the same levels. The thing I've realized is that taking a hormone is not the same as making it. We can help make up for part of what the body's not doing, but it's kind of like a crutch. It's not as good as a good leg. So those on thyroid medication have various risks. Risks for cancer, higher cancer risk for greater mortality, about twice the risk that way. And in many cases, even when they've gotten normal levels, they can have a lot of symptoms that you would expect for someone who has abnormal thyroid levels. So those are those parts of it. There's a lot of other, I guess, less tangible drawbacks, the cost, the hassle, the blood tests, and then just the idea, feeling like you can't trust your body, feeling like you've got to take this pill, and what if you couldn't get it? You'd rather not do that if you didn't have to. So, what are the conditions in which medications are given? Well, a big one is Hashimoto's. I should back up. So, we've got Hashimoto's, we've got hypothyroidism. Hashimoto's is an immune attack in which the body goes after the thyroid, the immune system does, and hypothyroidism is too little thyroid hormone. Now, the most common reason behind hypothyroidism is Hashimoto's. So, they often go together, but you can have either, neither, or both. The most common scenario is to have Hashimoto's, but not to have hypothyroidism. So this is where someone has measurable antibodies, or there's some signs on the ultrasound of autoimmunity, but they still have normal thyroid levels. This is where most people come into the thyroid world. And here's the thing, meds don't help with this part of it at all. Almost everyone that I talk to, I'll ask them, why were you put on thyroid medication to begin with? And the answer I hear the most was because I have Hashimoto's. Meds don't help Hashimoto's. So then we've got hypothyroidism, and this is a lack of thyroid hormone. Now, this is something that occurs by degrees. You can have a mild, moderate, or severe lack. We can call this stage 1, stage 2, and stage 3. Stage 1 is where your blood levels are normal, but something's not right. Maybe your scores are not where we could say are optimal, or maybe you've got some really strong thyroid symptoms, or T3 is low, TSH is high normal, you've got a low body temperature. There's something other than blatantly abnormal labs pointing towards a thyroid problem. And this is real. This isn't me saying that this is a made up thing. It's real. And this can cause symptoms. This can correlate with risks. Totally real. But medications don't help it, not in a consistent manner. The next step is what we call stage 2 or subclinical hypothyroidism. Here's where the TSH is way out of range, way above range. The T4 has not dropped off. It's not gone below range. So it could be low normal, but it's not below range. At this point, again, you could have symptoms, but massive, massive data sets have shown that meds rarely help. And here's the thing, this is tricky. You may be someone who's on medication. Maybe they did help. Maybe they do help. Maybe they did seem to. But when you did that, I would ask you, did you do other things as well? Pretty much everyone does also change their diet, change their lifestyle, maybe add in some vitamins. And when you do all those things together, it can be tempting to think that the medicine is the big guns, the medicine is the thing that made the biggest difference. But when we look at the studies, they're helpful because they have just one variable. So many studies were done in which people didn't change their diets or go on supplements. All they did is go on medication. And in those cases, the medications don't help. So when someone tells me that they had a diagnosis like Hashimoto's or suboptimal hypothyroidism and medications helped, it's more likely that the other things they did were contributing. Because when meds are the only factor, they didn't help. It's kind of a dumb old joke about a business would print up a card saying, this card plus $3 will get you a free coffee at Joe's Diner. And the joke is, if you actually brought that into Joe's Diner, coffee costs $3 anyway, so the card doesn't help. So that's how medications work. They're there, and some folks have taken them, but when people do just that, they really don't help. The next stage is what's called overt hypothyroidism. Here's where the TSH is really high, like over 20, and the T4 is well below range. Sometimes meds help. Meds aren't the only option. Many who are there can still benefit by other measures. I'll talk about that. But meds have a greater chance of helping. And if people aren't benefited by other means, then they're totally a reasonable thing. So when does someone definitely need medication? Well, they definitely need medication if their thyroid has quit, if it's been taken out, or if it's been destroyed via radiation, or if it's shriveled down to nothing. They need medication. Nearly everyone in those cases does long term. In all the other situations, there are other options that can work really well. The first big thing is diet. I got into this gig because I always thought that food was powerful medicine. And in the recent past, there's been big studies showing that diet can reverse thyroid disease for most people. So those conditions that I mentioned, the mild, moderate, and severe, if you throw them all together, studies suggest that about 60 to 80% of people can fully reverse thyroid disease just by dietary change. And that's not even taking into account those who don't go all in. So of those who go all in, the percentages are even higher. So diet can work, but diet is not all the same. There's a lot of different thyroid diets that are talked about. And kind of like the problem with medication, if someone does a lot of things, they don't know what did what. So many popular diets, when they are tested as the only variable, they don't really make a difference. But the one that has is a diet that regulates iodine. There's a low iodine window that gives the thyroid a really good chance to heal. And these were the studies that inspired me to write the Thyroid Reset Diet because they work. They work for nearly all people. They're safe and they're effective. Once someone has healed their thyroid, they can be more lax and have a broader range of foods and still do really well. But it's not about necessarily gluten-free or paleo or autoimmune or lectins or oxalates or nightshades, or these things are totally fine for people in some cases, but they've been looked at, they've been studied. They're not what you would lead with because they're not as likely to help. I think about clinical trials just like product reviews. There's a lot of what am I looking at here? Got some nail clippers sitting on my desk, right? So you can find a lot of nail clippers on Amazon. And if you're like me, you're going to look at consumer reviews and which one's got the most high reviews, right? It could be that some random nail clipper that only had 1 star from the manufacturer's mom. That might be one that you really like, but you're not gonna try every one in hopes of finding that. You're gonna try the ones with the best reviews first. You're gonna see what's most likely to work. You're not just gonna go blindly from one to the next. You'll do it in a logical order. And I would say do the same thing with your health. Clinical trials are just like reviews. You can know what's most likely to help. People are different. You might need something different. That's totally true. But what's most likely to help? That's where you'd want to start out. You want to start out with the best product that's most likely to be best. You don't want to start out just randomly. So, yeah, enough of that soapbox. The other big thing that can make a huge difference are nutraceuticals and great data around this. There's some things that we just need, some nutrients we need, we're commonly low in, and we can lack them. And that can be a big part of why the thyroid's not working well. That's part of why these things can help. Another thing is that nutraceuticals can help lower the inflammation in the thyroid. They can help the cells regenerate. They can help the body respond better to thyroid hormones, and they can also lower and reverse autoimmunity. This data inspired me to create thyroid-specific formulations. I came across all these same studies the same time I was going through a comprehensive literature review when I wrote the Thyroid Reset Diet. And I realized people need products. They need ways to have this stuff bundled in a cost-effective, proper way that was done like it was done in the clinical trials. So hypothyroid support, antibody support, Thyroid Daily. There's really simple things that can help a lot with helping your thyroid heal. So if you do need medication, totally appropriate, many do. The main thing there is being on ones that are appropriate for you, that are the best options, that are effective but not any extra. A weird thing is if you take more medication than needed, or if you take it unnecessarily, you can have the exact same side effects you would have if you were simply hypothyroid and untreated. So what do you do if you've tried some of these things and you're not making headway? If you've tried diet and you've not gotten better, check your iodine. It might be the case that your body needs more time or more thorough iodine avoidance. The urinary iodine to creatinine ratio is the correct test here, and ideally you want your levels below 100, and that's going to be the units of micrograms of iodine per gram of creatinine. So yeah, check that out. If you're not there, there's something missing or it's going to take more time. The other big thing would be comorbidities. There's a lot of other conditions that go along with thyroid disease. Most people with thyroid disease have many other conditions, often more than one. And a lot of these are undiagnosed and undertreated. These can cause symptoms, and if they're not addressed, you can not feel well, and it'll seem like the medications aren't working. So you want someone that can really look at things like parathyroid disease, fatty liver, adrenal dysregulation, latent iron depletion, and more. There's about a dozen and a half things that are really common and several dozen that are less common. Other issues can be wrong dose, wrong medication. Natural options can be good. It can take some fine tuning. But if you're someone who's in that stage one, stage two, medications probably weren't the solution to begin with. And there's often no way to get them right. The best thing is to back off and go through the process of de-prescribing. And many can take less, many can come off and do really well following some of these same guidelines of diet and safe nutraceuticals. All right, Dr. C here with you. Take great care. We'll talk again really soon. Bye-bye.